One of the most important decisions you can make about your life is frequent medical screening. Medical screening, also called preventive care, is a proactive approach to medicine that is focusing on prevention and early detection of diseases. Aside your own preventive measures that you undertake, like eating good food, enough sleep, physical activities like exercise, gym sessions, walking are good preventive measures. But you need to always go to the hospital either every 6 months or 1 year to also have a full medical checkup so that in case anything is starting anywhere that you cannot see physically, that means you'll be able to detect it early so that if it is treatment, you can start it early. Let me answer one of the popular questions that most people always ask. That is, why should I go for medical screening if I'm not sick or if I don't feel like I'm sick? You need to go for a medical checkup because most diseases, when they start, you don't show signs and symptoms. You see, according to World Health Organization and Center for Disease Control, 90% of non-communicable diseases are asymptomatic. What do I mean by asymptomatic? What I mean is that most of these diseases, when you have them, you will not see physical signs or symptoms on your body. By the time you begin to see those signs and symptoms, you should know that it has progressed to a stage where most of the times it will be very difficult to even treat or manage them. That is why you will need to go for a medical screening every 6 months or 1 year to always make sure that in case anything has started, you can detect it early. And once you detect it early, the likelihood of treating it or even preventing it to progress further is high. These are the main reasons why you need to go for medical checkup, as I've mentioned earlier, but there are even other aspects too. The first one is that when you go for medical checkups, it helps you prevent diseases because some of the risk factors and things will be discussed with your GP or your doctor so that you will know how to prevent it. If it's about modifying your food, if it's about going for gym sessions or exercise, if it's about going on a special diet, all these things can be discussed, and once you implement them, you are able to prevent some diseases from starting. The second most important point why it is very necessary is that it helps you to detect diseases early. Which is sometimes the outcome of diseases is dependent on when it is detected. If you are able to detect diseases early, but their management outcomes are always high or very positive. But if you detect diseases late or in the late stages of diseases, it's always very difficult to manage them. The third point is that you want to get better outcomes. As I mentioned, the earlier you detect, the better outcome. So once it's detected early, they are able to put you on programs and treatment that can give you better health outcomes. Let me take you through when you go for a full medical checkup in a hospital or in a GP center, the things that are involved. One, the main thing they are going to do is that they are going to check your vitals. Let's say check your temperature, your blood pressure, your height, your weight, and use it to detect whether you're overweight and all these things. So even from the vitals, they'll be able to detect if something is starting because from your weight and height, they can check for your BMI, your body mass index. I'll be able to tell you whether you are overweight or whether you are obese. And when they realize these things, they can advise you accordingly on what to do so that to reduce weight or to manage your weight so that you don't develop complications. Secondly, they are going to do a consultation. They are going to ask you about your family history, uh, medical history, social history, mental history, your vaccination history. Uh, if you're a female, they will ask about your uh, reproductive history, almost everything concerning your health. They are going to ask about it and they are going to discuss it with you. The third thing that they will do when you go for a medical checkup is that they are going to do a physical examination. A physical examination is looking from your head to toe. They will examine your body, they will do palpation, they will palpate your abdomen in order to see whether you have organ enlargement, whether some of the organs within your system is enlarged. They are going to look whether you are pale. They are going to check you and see whether you are a woman, all those things. So the full physical examination also helps them to detect other diseases, especially when it comes to skin problems or skin diseases. They are able to detect them on the observation and all these things. And the last part is after they do all these things, they will have to take you to the laboratory to go and do diagnostic tests. So they can take your blood to do a test, they can do a scan to look at the organs, see how they are. They can even do an x-ray to detect, look at how your bones are and whether everything is fine. And do CT scan, they can do MRI, and these are advanced form of test. So whatever it is, they are definitely going to have an idea about it. If after they do all these things, everything is fine, then that's fine. That's okay for you. But once there's a problem, the GP is going to have a plan with you, whatever that they have detected, whether if it's diabetes, if it is blood pressure, or if it's an enlargement of any of your organ, the GP person is going to take you through what you can do that will make it not complicate or even prevent it entirely, depending on the stage at which it was detected. So basically, do all this and they will now have a conclusion with you. Whatever they see, they will explain to you and tell you maybe the possible causes, and they'll be able to advise you on how to manage whatever they've detected. In conclusion, what I want to tell you about medical screening is that do not see it as an optional appointment. See it as an essential schedule maintenance for your most valuable asset, that is your health. If you see it that way, you will be committed and be consistent in going for it, even if you don't have any issue. Your health is the most valuable asset that you have on this earth. It is always important to have a budget for your health too. Like the way you have budget for your car maintenance, you have budget for your material things. Once you have a budget for it, you will be able to go and do these things. Sometimes one of the reasons why people too might not go is because they might not have money or funds to go for this full scale. But you see, they will always have money or they will always have budget for other things. Anybody that has car already have a budget for its servicing. So if health is your biggest asset, then you will always need to have a budget for it. Once every year or twice every year will go a very long way to help you improve on your health. And if your health indicators are good, that means you'll be able to go about to do everything that you are supposed to do on daily basis without any problems and without concerns. But once you are not going for these frequent checkups, you might start developing conditions that you might not know. By the time you begin to realize that you're having some condition, it might be late. And once it is late, the doctors or the GPs will have limited options to handle it. And at the end of the day, it end up by affecting you. So take charge of your health and make sure that you are going for scheduled medical screening. If this video has given you some knowledge or some importance about your health, follow this channel. We are going to have more of these things on this channel. Subscribe to it, put on notification and comment. It is a knowledge sharing platform. So whatever you also have to contribute about health, share it on the comment section so that we'll pick it up and we'll all learn together. Thank you.